super. So I think most days doing cruciate ligament surgery start with the boring stuff, or so Duncan keeps telling me. And my PhD was in cruciate ligament surgery. Cruciate ligament etiopathogenesis is one of these things that, do you need to know it to do the surgery? Well, no, you don't. But what you do need to understand is that when a dog comes in with a cruciate ligament injury, disease or rupture or whatever stage it's at, you have to start thinking, how does that come about? How is that related to a surgical treatment? Is there something else causing this problem? And start to think a little bit outside the box. We are teaching you TTA today. TTA is a good technique. If it's done properly, if you do it the way we teach you to do it, you'll have good success. And I would suggest that probably 50% of the dogs that come in with cruciate ligament disease, you can manage successfully with a TTA, maybe slightly more. But there is another group of dogs that it might not be the appropriate treatment for. Very small dogs, very, very big dogs, dogs with unusual shaped tibias, dogs with unusual stifle pathology. It might not be the appropriate technique. And the reason for going through the etiopathogenesis is just to get you thinking, why has this come about? And we always talk about the outliers, because if you get a straightforward cruciate ligament that comes in, it's a cruciate ligament rupture, it's a Labrador, it's 3 years old, it's got a cranial draw, it's acutely gone lame, it's got a bit better medicament, all the usual things we're going to talk about, that's an easy diagnosis. But what's a bit more challenging is when you've got an 8-year-old Cavalier King Charles that's gone acutely lame and you've got cranial draw, but it's got no history of lameness, it's not a breed that perhaps you might expect to get it in, and you're thinking, well, it's a bit odd, I don't see many Cavaliers with cruciate ligament disease. It's not possible, it does happen, but, and I'm talking about a case that I saw quite recently, this dog had had a TTA done on it, hadn't got better, sent it to me, and I saw on its radiographs it had a fairly obvious distal femoral osteosarcoma. And that was its problem. Yes, it had a cruciate ligament rupture because the tumour had eaten away the origin of the cruciate ligament. So it's the background to cruciate ligament disease is just to make you think, when a dog comes in, always think laterally. Everyone can spot cruciate ligament disease in a dog. You're all at that stage where it shouldn't be a challenge. What we're going to try and do is fill in the gaps of what can happen, what's a challenging case, and then bring you around to the surgery.